Thank you all. So first of all, I'd like to thank the conference organizers as well for putting together a really amazing conference, in particular Dr. Crow and Dr. Ariasi and Dr. Sheikh. The quality of this conference has exceeded my expectations. I've gone to a lot of international health and medical education conferences, and typically what I find is that they're very unidirectional, right? So it's the exportation of Western ideas basically to wherever it lands. Here I've learned quite a bit bidirectionally, and I really love what I learned from Hong Kong, from Singapore, from China, from Taiwan, from the UK yesterday, and I'm taking some of these lessons home to my team. So I was So I'm the co-founder and CEO of Osmosis, which is a medical education company. And I started my journey when I was a medical student at Johns Hopkins in 2011. And my anatomy team-based learning partner and I, his name's Ryan, started talking about how medical education was different than other forms of education we had done. Both of us had backgrounds in neuroscience. He had a PhD in neuroscience, computer science, and engineering. But we realized that health education was different than other forms of education for three reasons. The first was, this is an incredibly vast amount of knowledge, right? With the discovery of new fields, for example, genetics, Dr. Noor was talking about how the American Board of Medical Genetics is one of the recent boards because there's so much more genetic knowledge that we didn't have when many of the physicians in this room trained. And so there's studies that show that the amount of biomedical knowledge doubles every 7 to 10 years. The second reason is it isn't just an expanding amount of knowledge. The knowledge you learn is dynamic. So one of the frustrating things about medical and health education is if you learn something in medical school, within 10 years, 50% of that may be out of date or wrong. And so you have to constantly update your knowledge. And the third and most important reason that medical and health education is different than other forms of education is it's high stakes. So if you're trying to learn a language and you forget how to conjugate a verb or a vocabulary, the worst you'll do is embarrass yourself. But in medicine, if you forget the side effect profile of a medication that you give to a patient, you can actually hurt that patient, hurt their family, and in the process also hurt your own career. And so these are the three reasons we thought that whatever we built for medical and health education had to take these into account. The other thing that compounds the difficulty of medical and health education is this. Basically, you require so much training that many of the groups that ultimately train you are siloed. So what I learned in college, most of it wasn't that important when I got to medical school. And at every transition point, there's places where you forget things or you aren't prepared for the next level. And this is why we think that any technology that is developed for medical and health education has to be very personalized, because somebody goes to one college, then they go to a different medical school or nursing school, then they go to a different postgraduate, and it has to take into account what that individual learned and not just what the program teaches. And so two things really convinced us to take time off of med school and start a company, and in the process scare our parents. The first was this notion that there is a shortage, or at least a regional misattribution of talent for clinical professionals. In the US, there's supposed to be about 90,000 physicians more needed by 2025, many of whom are primary care physicians. And then secondly, so we have to train more clinicians, or at least train the right types of clinicians. But the second thing that kind of concerned us was the number 3 cause of death in the US is medical error. And a lot of this is systemic, but much of it is also knowledge-based. It's based on the fact that you don't actually monitor side effect profiles. And so we looked at these two, and the two conclusions were, one, we need to train more clinicians, and we need to make them better at what they do. And as we learned yesterday, there are physician and nurse shortages here in China, in India, and in other countries too. So this is a global problem. The WHO estimates about 12.7 million clinicians are needed by 2020. So with looking at all those challenges, we saw some opportunities to create a tool that could hopefully help contribute to fixing the problem. And basically, it combines two things. First, it's a learning platform that enables collaboration and personalization. And then the second is we develop high-quality content that goes into the platform. And so the way to summarize what Osmosis does is it's an app that manages med school for you. And one of our users put it, it's an electronic personal assistant. Essentially, it does that personalization. It understands what that learner is learning at any point in their training, and then will automatically recommend the right content. And I'll show you some slides of how that works. And the purpose of this is not only to help students pass their exams, which obviously is very important, but ultimately to help them become better clinicians. So when we were just getting started, Ryan and I wrote a paper for the Annals of Internal Medicine called "What Can Medical Education Learn from Facebook and Netflix?" And this was because when we went into the lecture hall and we looked at the few remaining people who were still sitting in lecture watching their professors talk, we realized that most of them had other sites up. There were Facebook, there was Amazon, Netflix for the most brazen students who were listening to it while the lecturer was talking. And we realized that these tools are much better at engaging users, not only because of the content, but because of the personalization that they've incorporated. And so here's an example, targeted advertising. So when I Googled a few weeks ago pants, the third entry down was an ad for Nordstrom, one of the popular US retailers. And then the next day when I logged into Facebook, I had an ad from Nordstrom. This wasn't coincidence. This is because these companies understand what we're looking at, our browsing history, and then can recommend content. So we took this concept of targeted advertising and we turned it into targeted education. So one of the schools we work with is University of Michigan. So on Wednesday, August 31st, these medical students we know were learning about cystic fibrosis on the 31st. So on the 30th, we sent them a 3-minute patient video of a patient who has cystic fibrosis to prime them so that the next day they actually understood why they were learning what they were learning. And then after they learned it, on September 1st, we sent them a push notification to their phone with a question quizzing them on what they had just learned the day before. And so it's this sort of personalization that we're trying to drive into medical education. In the context of practicing clinicians, this isn't lectures. This isn't necessarily PowerPoint slides and lectures. This is what they're reading and what types of patients they're seeing. So if they read the latest guidelines on diabetes treatments on up-to-date today, then tomorrow they should get a question quizzing them on that guideline. So to date, we've had over 150,000 health professional students, medical, nursing, pharmacy, PA, et cetera, use Osmosis. And they've answered 25 million questions and created 2 million questions themselves, which they've used to quiz each other. That's part of why we called it Osmosis, is that knowledge diffuses not only from professor to student, but also between students now. And to date, these students have uploaded over 1.6 million curricular documents. So these are PowerPoint slides, lecture notes, their own notes, and those constitute 6 million curricular pages. So we have a very good understanding of what schools around the world are teaching current medical and nursing students. In 2014, we started with one school that we worked with. Then in 2015, we picked up 10 more schools, including Duke NUS is one of our schools we partner with. And then 2016 went up to 25, and so far in 2017 we've started working with 5 more schools, including Weill Cornell Medical College in Qatar. So that's the platform. I'm just going to transition quickly to the content, because ultimately in medical education, the platform's it's not even half the equation. It's probably 25% of the equation, because the most important thing is the content. Is it valid? Is it engaging? Does it actually teach people what they need to know? So about a year and a half ago, the Khan Academy, which some of you may know, it's a popular nonprofit in the US funded by the Gates Foundation, they had a health and medicine team that decided to join Osmosis. So because Sal Khan and the Khan Academy wanted to focus on K-12. So this Khan Academy team joined us, and since in that year and a half has produced 250 videos with about 15 to 20 more videos added each month. And these are on popular topics such as congestive heart failure, endocarditis, things that not only health professional students and current clinicians care about, but things that patients care about. And so one of the biggest partnerships we established very early on was with Wikipedia, which is a top 5 site in the world. And so this is the diabetes page in Wikipedia, which you could pull up if you don't have to VPN. And on the bottom right, you see right there, there's a video now on this Wikipedia page and about 200 others at this point. And when you click on it, it's the Osmosis video. So this is another Wikipedia page. This one is the one on Zika virus, which some of you may know had an outbreak in the Americas last year. And so we produced this video within a few weeks of Zika virus having an outbreak, so there's a big public health aspect of what we do. And then within a week of releasing the video, we had it translated into Portuguese, because obviously Brazil was an epicenter of this outbreak. And it goes through essentially the pathophysiology, the diagnosis, public health, epidemiology, and sometimes the treatment. Though the treatment is very regionally specific, as well as it's more dynamic. Another example is when Hillary Clinton was diagnosed with pneumonia back in September, the Washington Post decided to use our video on pneumonia to explain it not to a health professional audience, but to the general public. We've also done another video. This one was for Hillary Clinton's condition. We have one on personality disorders that was about one of the other presidential candidates that was part of last year's debacle. And so, in any case, we receive a lot of comments from people who use these videos to learn. What surprised us was we initially set out to make videos for medical students, for future physicians, but then very soon we started hearing from students in nursing, in pharmacy, pediatrics, pediatricians, and people applying to PA school. So we started realizing that the style of content we were producing was very generalizable. And then what excited me the most personally was that it wasn't just medical students and professionals, or health professionals, I mean. It was patients and their family members too who were using these videos. And yesterday we talked about how the aging populations in this country, in the US, across the world, as well as the prevalence of non-communicable diseases, means that we can't rely on a healthcare system that just does acute treatment. It has to be able to do chronic care, and more importantly, convince patients to change their behaviors. Convince people here to stop smoking, convince people in the US to stop smoking, to start losing weight, to start managing their blood pressure. And so we started hearing from patients too, who have various conditions. For example, this one was talking about how his father, he used our video to educate his father about hypertension. And so that's part of what we're really excited about, is making sure these videos also reach patients and their family members. Just last week, we had a timely testimonial sent to us from a general surgeon in China who's volunteering with the Chinese medical team in Africa. And he was saying the Osmosis videos are great. They help explain complex medical issues in an understandable way in only several minutes. So most of our videos are under 10 minutes. So far we've reached 217 of 218 countries. If any of you have friends or know people in North Korea, that's the last one we need to get to 218. And these videos are being translated into many other languages. So here's an example of our congestive heart failure video, which has been translated into Korean. And I'm going to just play a 30-second segment from our epilepsy video, which you can switch to. This one was a Chinese medical student decided to subtitle it.
Epilepsy means seizure disorder. So people with epilepsy have recurring and unpredictable seizures. A seizure is a period where cells in the brain, or neurons, are synchronously active, or active at the same time, when they're not supposed to be. Now, when I say neurons are active, I mean that they're firing, or sending a message using electrical signals relayed from neuron to neuron. And if you look at a neuron under a microscope, each electrical signal that passes through it is really just ions flowing in and out through protein channels. The way this ion flow is controlled is through neurotransmitters, a type of signaling molecule, and receptors. Neurotransmitters bind to the receptors and basically tell the cell to either open up the ion channels and relay the
Great, so you kind of get a sense of that. That was just the beginning introductory, but we go into, again, diagnosis and treatment eventually in the video. And so to date, this is a graph showing our growth on the YouTube channel since January of 2016, where that month we had about 5,000 total views and 3,000 subscribers. And right now, this past month, we have 155,000 subscribers and 2 million views a month. So it's growing pretty quickly and it's accelerating. 8 million minutes are watched a month, and as I mentioned, about 155,000 channel subscribers. 74% of our traffic is outside of the US, with a lot obviously in Asia. And so one of the most interesting parts of what we've been doing is collaborating with healthcare organizations as well as other organizations to create these videos. So Kaiser Permanente decided to sponsor one of our videos on delirium, both to establish its kind of it's well known for its delirium treatments, as well as to train its own clinical staff on delirium identification and reducing the problems associated with delirium. Similarly, we work with Rush Medical College to produce 30 videos that have been released since June and have been seen over 1.5 million times alone. So we're increasingly working with organizations. Dr. Nora's organization, the American Board of Medical Specialties, created a video with us on how to write good assessment items for the health professions. We've also gotten grants from organizations like the Robert Wood Johnson Foundation, and Dr. Anderson's NBME gave us a Stemler grant, which is a research grant that we did with UIC and UCF. Finally, we are .org, where even though we're a for-profit organization, a lot of what we do is for promoting open and global health education. So we provide free access to a consortium of new Southern African medical schools, as well as in Iraq and Syria. We published about these initiatives in Innovations in Global Health Professions Education. So if you take a look at the journal, one of the articles is ours. And finally, our vision is by 2020 to have trained over 1 million current and future clinicians and to become a leading platform for international health and medical education. So I welcome any feedback during the panel as well as during the innovation descriptions. Thank you all for your time and attention.